South Africa is aiming to vaccinate at least 67% of its population against the coronavirus in the coming year in order to achieve herd immunity. The health minister has said that in the first phase, the vaccine will be made available to the 1.2 million healthcare workers. In the second phase, essential workers and those above 60 years of age and people above 18 who have comorbidities will have access to the vaccine. The third phase will see citizens above 18 being immunized. The health minister also said that the Covaxin agreement, which provides vaccines for low and middle income countries, will give enough vaccines to cover 10% of the population by the second quarter of 2021. As of the 3rd of January, there are 1.1 million coronavirus cases and deaths, numbering 29,577 in South Africa. The country is battling a second wave of new cases, recording around 11,859 average cases in a day. Yet, while at least 29 countries have already started inoculating their people against the virus, South Africa is yet to conclude any supply agreements with pharmaceutical companies. Our correspondent Kalden Ongmo from Johannesburg getting us more.
The South African government is aiming to vaccine 67% of its country's total population against COVID-19 to achieve herd immunity. Dr. Zweli Mkhize, who's the health minister of the country, yesterday stated that in order for the country to fight this pandemic, one has to achieve herd immunity. He said that rolling out of these vaccines will be done in 3 phases. First phase will include health workers with an estimated population of 1.2 million. Second will include the essential workers and also people with comorbidities and people living in close shelter. The third phase will include persons over the age of 18. Currently, South Africa is in agreement with Covaxin to cover 10% of its population. Initially, what the minister had said that the country wanted to roll out these vaccines at the start of second quarter of 2021, but because of the resurgence of COVID-19, they're going to fast track this process. The country is also in talks with other pharmaceutical companies like the Pfizer, AstraZeneca and Johnson & Johnson's. The minister also stated that the country's health system is put under burden with the resurgence. South Africa witnessed about 18,000 cases in 24 hours, which has been the highest since COVID-19 hit the country last year. We saw on December 31st about 18,000 infected with the virus, and this led the president to announce tighter restrictions and regulations. Currently, South Africa is level 3 lockdown, which includes the ban on alcohol sales and longer curfew. This is Kalden Ongmo from Johannesburg, South Africa for WION World is One News.
On to India's fight against the coronavirus now. Bharat Biotech's Covaxin is at the center of a national controversy. While India's first indigenous vaccine has been touted as a game changer, it has also triggered a debate in the medical circles. Covaxin has been indigenously developed by Bharat Biotech in collaboration with the Indian Council of Medical Research. So far, it has completed 2 out of 3 phases of clinical trials. The third phase is crucial as it tests the efficacy of the vaccine candidate. The Indian government's recommendation coming at a time when there is lack of efficacy data. The ongoing phase 3 trials for Covaxin in India began in mid-November. It has since been initiated in 25,800 volunteers. This makes it the largest phase 3 efficacy trial conducted for any vaccine in India. Bharat Biotech's chairman has now addressed these claims. He reiterated that the vaccine is safe, adding that the company is conducting trials in more than 12 countries apart from India. The company expects to release the efficacy data of Covaxin's phase 3 trials in a week. According to data, there has been 100% protection in Covaxin animal trials. The company also plans on carrying out clinical trials in children. The most important claim, however, was that the vaccine would work against the new mutation of the coronavirus. Earlier, India's health minister asserted that Covaxin is more likely to work against newer variants of the virus. He added that the approval is different from Covishield because its use will be in clinical trial mode. All Covaxin recipients will also be tracked and monitored once they receive the shot. WION now available in your country. Download the app now. Get all the news on the move.